Hello everyone and welcome to today's session. I'm Deborah Garlick from Henpicked Menopause in the Workplace and Menopause Friendly Australia. And we have a real treat today. Back by popular demand, we have Dr. Clare Spencer, and today's session is all about hot flushes and alternatives to hot flushes. Clare, welcome back to you. How are you?
Yes, hi, I'm great. Thank you. How are you, Deborah?
Very well indeed. Thank you very much. And this is a hot topic, Clare, because as we know, we talk a lot about HRT, we talk a lot about hot flushers, but actually today's session is about hot flushers and the alternatives. But I'm going to start at the beginning and say, hot flushers, what are they? And why do so many of us experience them during the menopause transition?
Yes, no, absolutely. And at least 8 in 10 women, depending on the studies, will experience hot flushes in some description. And we clump hot flushes and night sweats together and call them vasomotor symptoms because the stem is usually the same. So what it feels like is women tell me that anything from a rosy glow and feeling a little bit more sweaty than usual to feeling like there is a furnace inside your body, from feeling boiling hot from the tips of your toes up to the edges of your ears for some women, and just feeling like just raging heat. And hot flushes, and so that's a hot flush bit. And then sweats, some women literally in the night are having to get up, change the bedding, change their night clothes because they're drenched. Really sadly, I can remember right at the beginning when I started my clinic meeting a woman who'd cut her hair short because she hated the feeling of wet hair on the back of her neck. And they only last a few seconds in some, to a minute or two in others. But it can be really debilitating. So either impacting on sleep, or, if you're sitting in a meeting or you're speaking to somebody and you feel this sweat or heat come over you, women feel really embarrassed and anxious about them even occurring.
And it's understandable that it can not only get in the way, because, if you experience that and if you're in a meeting and you just think, oh, when is it going to go?
Mm.
But we've also had experience of women that say, do you know what, this is really embarrassing and I'm sure
Mm.
everybody's looking at me. And you can understand how somebody can feel really impacted by this. Do we know why it happens, Clare?
Yeah, so it's the change in estrogen, the drop in estrogen that affects the temperature regulation bit in part of your brain called the hypothalamus. And that changes certain chemicals in your brain that then change your temperature regulation settings. It's a bit like resetting the thermostat, so that then at hotter temperatures, actually you can feel colder. And at lower temperatures, you have more of an extreme dramatic reaction to heat. So although we've spoken about hot sweats and flushing, actually some women get cold sweats and get cold and shivery instead. It's really fascinating. And it's because instead of having a wide temperature variation sort of thermostat, it's narrowed and we react more dramatically outside that narrow band of temperature.
So in effect, your thermostat's broken.
Let's not say broken, let's say malfunctioning. Yes.
Let's say malfunctioning, because
Yeah.
it's interesting, because I've never had a hot flush that I'm aware of.
Yeah.
But I would say my temperature is significantly lower than it used to be. And I wonder if it's a similar sort of thing. It's, I might not have the heat, but I can certainly be wearing
Yeah.
my socks in bed in July. It's
Mm.
just one of those things I just don't seem to be able to get away from.
No, absolutely. And usually it settles down over time. So vasomotor symptoms last on average 8 years-ish in that menopause transition. But for some women, they just never settle. So I still talk to women in their 70s, even 80s, who started having hot sweats or flushes, in their sort of early 50s, and they've just not stopped. So the percentage does decrease as you increase with age, but yeah, usually they settle by themselves, but occasionally they don't.
And it's interesting you say it sort of, the regulation comes from the brain.
Yes, no, absolutely. And then that's like the control center. And so that then triggers all sorts of coping reactions in your body to cool down, like sweating is a way of trying to cool your core body temperature. So that's why we sweat. So yeah, it all comes from that control center in your brain.
Okay. Okay. So I'm afraid you just launched some bad news there for some people that were thinking, when are these going to end then? So for some of us, they may continue for a period of time.
That they may, but generally, and I know we're going to talk about ways of stopping them, coping with them, etc. But generally, in time, for most women, they will settle down.
They will settle down. Oh, that's good news. So, but according to the NICE guidelines, HRT helps us manage hot flushes, is one of the preferred methods for managing.
Well, yeah, HRT is probably the most effective method for most women. And I use those words carefully because actually HRT doesn't help hot flushes or night sweats for every single woman. And there are some women, and we don't really know why, for whom giving a bit of estrogen back doesn't seem to be effective. So that can be obviously very disheartening and debilitating. And some women obviously won't want to take HRT or will have been advised not to take HRT. So that's why we say it's the most effective, but it's not 100% effective for most women, but not all women.
Okay, so if we look at alternatives, and I know that we're going to come on to another pharmaceutical alternative, but are there other sorts of options? What are the range?
Yeah, massive range of options. So some of the options will help deal with the symptoms. So if we just think about really simple things like making sure you're wearing cotton that will pull the sweat away from you, dry wicking fabrics, again, pull the sweat away and allow your body to calm down and allow the sweat to evaporate off. So thinking about what you're wearing in the daytime and the nighttime can make a difference. And having layers, so you can take a layer off, put a layer back on again, can be helpful also. Don't wear a shirt to a meeting that will show the sweat really easily if you're worried about having a sweat. And then again, looking at what's on your bed, so cotton bedding. Some people say, oh, I think it must be better to wear nothing and have no covering at night, but actually it might be better to have a layer of cotton that pulls the sweat away. And obviously having a fan to hand, opening windows, having control over your environment can be helpful also. And also that can help diminish some of the anxiety about having one of these symptoms, because anxiety can then make it all worse as we produce more adrenaline that obviously then can make you sweat a little bit more.
Okay, so what about exercise? Because I was reading something around high intent exercise can actually help reduce hot flushes. Is that true or false?
No, so it can, and like anything, it can be really personal for different women. There are studies that show exercise helps well-being, helps weight loss, helps reduce the risk of osteoporosis and heart disease, but may not reduce hot flushes. But for other women in other studies, it may have been helpful. And it doesn't really matter what form of exercise, it's finding the right thing for you. There was a paper published last year that showed, for example, cold water swimming was helpful for some. Again, it's not going to be helpful to everybody, but exercise can definitely help. And if you can, I know weight loss can be more challenging in the menopause, but it sort of makes sense, doesn't it? If you can just really marginally start to reduce some of that insulating fat around the body, that may also be helpful, and exercise can help in that aspect also. So yeah, exercise, give it a go.
And CBT, I saw the study that came out from the research around CBT, and I don't know how actual effective it is. I know when we did there was a trial on women, and I don't know if it actually reduced the hot flushes. They were suggesting it reduced the hot flushes, but it certainly helped them not feel quite so embarrassed about it, understand what was going on, and stop
Catastrophizing. Yes, no, that's right. Most of the data that shows an effect for CBT is for women who've had breast cancer. And cognitive behavioral therapy helps break that vicious cycle, that link between feeling embarrassed and anxious about your hot flushes, and then that making the hot flushes or sweats worse because the embarrassment induces more of the chemicals that can make the sweating worse. So CBT and relaxation, just being able to breathe through, thinking this is going to last 30 seconds, I'm just going to breathe and it will pass. You know, CBT can teach some of those techniques that can really help that. And that's why relaxation can be helpful as well. And as well as talking therapies, there are other sort of lifestyle bits. So say avoiding alcohol. Alcohol causes vasodilation, and that can make your hot sweat worse. Some women I speak to only have hot sweats in the night when they've had a glass of wine before they go to bed, for example. And similarly with diet, avoiding big sugar spikes. So just having a look at your diet and trying to keep your blood sugar vaguely stable also can get you marginal wins.
Knowledge is power on this one, isn't it, Claire? You know, you might not want to have the glass of wine before a big event the next day, but actually on a Friday night, you might be happy to sort of put up with the hot flushes the following day.
Yes.
But you mentioned earlier about because not everybody wants to take HRT, do they? It's a personal philosophy. If you want to take HRT, it should be available to you depending on your medical health and agreement with your healthcare practitioner. But you mentioned that there are some people who can't take HRT.
Yeah, there are very few people who absolutely can't HRT and take it. And often it's a discussion about the risk benefit ratio between you and your doctor with your specific diagnosis. But many women who've had an estrogen receptor positive breast cancer, or there are other types of more high risk hormonally dependent cancers, like some of the less common sarcoma type cancers that can affect the womb, have often been advised not to take HRT because often there's a lack of data to reassure about safety, and women do not want to take the risk. So it's not just breast cancers. There are other cancers that may be estrogen dependent. There may be other health conditions where people maybe have been advised that we don't know exactly how HRT is going to affect you or how safe it might be. And then often women have tried HRT and they've had really awful side effects. It doesn't happen very often, but often they don't tolerate HRT or they haven't found HRT to be hugely helpful to them.
Thank you, Claire. So those who can't take it, albeit a smaller number, might not realise. Those who don't want to take it, or those that have tried HRT and said, you know, the side effects of the HRT or the taking the HRT didn't really suit me. Or actually, there's another category. There's somebody putting into chat that actually I tried it and it didn't actually get rid of my my hot flushes.
Absolutely. Yeah.
So I did a happy dance. There's a new product on the market that might be very helpful for us all that experience hot flushes. And, you know, another choice is always helpful, isn't it? Veosia?
Yes, Veosa that is the trade name for fezolinetant. And this is a medication that works on the pathways in the brain to try and stop the hot flushes from happening. And the studies have shown that it's up to 60% effective in reducing the severity and frequency of hot flushes. I haven't prescribed it to many women, but those I have prescribed it to, it's completely changed their life. It's allowed them to sleep, get a night's sleep through, and has really had a positive impact. Unfortunately, at the moment, it's only available privately. And I know there are moves to change this and for it to be available on the NHS, but that hasn't happened yet. I hear talk of it hopefully becoming available towards the end of the year, but I've not heard that there's been an exact date. And these things are often a movable feast. But it is available privately, and it's around £85–90 a month-ish, depending on the pharmacy and the clinic.
Okay, well, thank you very much, Claire. So first of all, if we sort of explore, how does that work? Does that affect your brain then?
Yes, yeah, it's a blocker in the pathway that causes the hot flushes to develop.
Okay,
A
so
neurokinin 3 antagonist, to be specific. So it works directly in the bit of the brain, the hypothalamus, that helps the hot flusher, that, you know, triggers the hot flushes.
That's really interesting. So it stops it at source.
Yes, yeah.
And can work for so many people. I've got a couple of questions about that one then. Are there any side effects with that one? Because you mentioned with some people that experience some people can't tolerate HRT, I think was your words. How are you finding the experience of actually using it? Is it a good experience?
Yes. Yeah, no, it's, well, in the small number of women I've prescribed it to, and colleagues also, it seems to be really well tolerated. Side effects listed off the top of my head are abdominal, I think headaches and sleep being affected, but that doesn't seem to have been the case. There's a really small risk of liver function becoming abnormal. So if you have a history of liver disease, it just needs approaching carefully, and you'd need some liver function tests before and during you were taking it. But it seems at the moment to be well tolerated. I think the issue with hormones is, you know, some women are just through no fault of their own hardwired to be more intolerant to hormone changes and hormone levels. They may have had premenstrual syndrome in the past or postnatal depression, and so, you know, can get pretty significant side effects from adding hormones back in HRT. So that seems to be a different thing to the Veoza or fezolinetant, which isn't a hormone.
Okay, so so would that be available to anybody then?
So we do, there are cautions, and it hasn't been tested in women who've had breast cancer or undergoing treatment for breast cancer. It hasn't been tested in older women. So at the moment, they're only recommending it for women who've had their treatment for breast cancer, not actively being treated. So again, it because it's a new medication, it hasn't been tested in every circumstance. So it would be a discussion between you and your doctor as to whether it was something that was going to be appropriate.
As you say, Claire, it's a shame that it's not available on the NHS yet.
Hugely, yeah.
This is something that My Menopause Centre offer.
Absolutely, yes, yeah.
Okay, I'm just thinking of a certain individual in my mind who is absolutely desperate to get rid of the hot flushes. HRT didn't do it. So this is another alternative.
Absolutely. And there are other medical alternatives that can be helpful. For example, SSRI types of antidepressants and SNRI types of antidepressants like venlafaxine, citalopram, sertraline, fluoxetine. You know, they show pretty good effectivity of taking the edges off hot flushes and night sweats. Again, as an alternative to HRT, there's a tablet that you can take for your bladder called oxybutynin. It helps calm down an irritable bladder. Again, there's emerging evidence that that can take the edge off hot flushes. There's a blood pressure tablet called clonidine that can take the edge off as well. So if this isn't something that you could get privately, then there are lots of other alternatives that your doctor can prescribe that are available on the NHS that have been shown to be really quite effective.
Thank you very much, Dr. Clare. And Sally, I can see that we're getting a lot of questions coming in, but as you say, so there's a lot of options there, Claire. Even if somebody doesn't want to take HRT, there are a lot of other options.
There are absolutely. The headline options will be lifestyle changes, talking therapies, alternative therapies for some, like acupuncture, hypnotherapy. Some people like to try homeopathy. The evidence for all of those is a bit hit and miss, but often there aren't the right studies that have been done. Then there's alternatives like herbal medications that some people will look at. Word of caution, they can interact with prescription medication, so you have to be careful with herbal remedies. Then alternative medication, as we've spoken about, like Veoza, the SSRIs, SNRIs, and then obviously there's HRT itself. So there's a whole plethora. I know you've got information on your website, Deborah, we have as well, of alternatives. So please don't be disheartened if the HRT hasn't worked or you've been advised not to take it. Lots of other options.
Thank you very much, Claire. Sally.
Yeah, I mean, as always, just want to say a huge thank you to everyone for sharing and supporting each other and sharing things that have worked for them or questions. It's, you know, we always love these sessions because everyone is so supportive of everyone. So we've got a few key things coming up. So we've got a few that are sharing there, getting still getting hot flushes, kind of ones shared 14 years post-menopause, 10 years post-menopause. It's really kind of what could they do to help manage that? Is there anything specific when you're that much further post-menopause that may be helpful?
I think everything still applies. It's quite good if you go to your doctor to talk about it, to, if you can, have a look on your records and make a list of things that you have tried and haven't worked, or they may have worked a bit. Sometimes passage of time can help. And so something that didn't work 10 years ago may be helpful now. You know, I know that we're talking about alternatives to HRT this morning, but, you know, HRT could still be an option for you if you wanted to revisit that. So top tips are the options are all still there for you, but make a list of what has and hasn't worked if you're going to have a chat with your doctor.
Yeah, and I think that's, we've heard somebody was saying that they're getting hot flushes that are lasting like 20 to 30 minutes, and they're feeling really dizzy and really sick. And I think that's one of the big things. If somebody's really struggling like that, it's really important that they go and see their doctor to understand what's going on. But we've also had people saying that they're struggling to have conversations with their GP, not finding them particularly supportive. So any kind of top tips?
Yeah, so I think if you're having really severe hot flushes, don't forget that we haven't touched on this yet, but menopause is not the only cause of hot flushes. So, for example, thyroid disease, there are some other rare but serious conditions that can cause hot flushes. So it's really important that you speak to your GP and they do some blood tests and rule out other causes that can include sinister causes. Hence, it's really important that you do get those ruled out. If you find that your GP is not listening, I would go back, absolutely. Try a different GP, speak to the receptionist, see who the GP with the menopause training is in your practice, or it might be the practice nurse or a nurse practitioner who is the one with the training. So don't put up with a non-answer. Please go back.
Yeah, and that's what someone's just said, that the menopause specialist in their GP practice is the nurse practitioner, and that's been really helpful.
Oh, yes.
And we've got a few questions around taking HRT for those that are. Somebody saying that the HRT was working, but the flushes now come back. And someone asking around how long can you take it for? And if you stop taking it, will the hot flushes come back? So kind of just a bit of an understanding around where people are taking HRT, what they may need to think about.
Yeah, so if, like me, your doctor started you on a low dose of estrogen at the start of the menopause or earlier in the perimenopause, it may be that with the passage of time, you need a bit more estrogen to help manage your symptoms. And on the other side, sometimes if you have a lot of estrogen, more than standard doses of estrogen, sometimes actually that really, really super high dose can trigger hot flushes. So if you're on a lower dose, it may be that you need to go back and talk about changing that and increasing it. If you're taking a lot of estrogen, like 8 pumps rather than 4 pumps of estrogel, for example, then you need really careful management to slowly reduce your estrogen back down again, because that might be helpful also. In terms, and we don't recommend you use 8 pumps of gel, but sometimes people are increasing doses. In terms of HRT has helped your symptoms and you've stopped it and symptoms come back, it may be that you need to take the HRT for a bit longer. We know that HRT doesn't pause. Your body's adapting to its new state of low estrogen. So if you think symptoms of estrogen deficiency, like hot flushes, start early in the menopause transition and they carry on into the post-menopause as our body adapts to its new normalness, HRT doesn't slow down that adaptation. So when you stop HRT, you'll feel how you were programmed to feel at that age anyway. So it may be if the symptoms have all come flooding back, actually you need a chat with your doctor about it. And again, go back, just making sure that there's nothing else going on. Just make sure those hot flushes are menopause related.
Okay, and quite a few people have mentioned, I know you mentioned clonidine, people have also mentioned tibolone. Just kind of, again, though, those other alternatives to HRT, and people saying, you know, they couldn't, so someone's going through cancer treatment and they've had to increase their dose of clonidine 3 times. So just, again, just that understanding of what do those medications do and when might they be appropriate?
Yeah, so tibolone is actually classed as HRT. It's a selective receptor modulator. So it's a molecule, a chemical that plugs your estrogen receptors. And so that's why it can be effective in preventing menopause symptoms. It plugs your progestogen receptors. So it's effective in keeping the womb lining thin. And actually it plugs androgen receptors also. So it can help libido. So the same pros and cons apply to tibolone as apply to HRT. So if you've had breast cancer, for example, we wouldn't recommend that because it has been shown to increase the risk of recurrence of breast cancer. Clonidine, so all of the clonidine antidepressants and the oxybutynin, they all act centrally on the brain, again, to help prevent the formation. And I saw a comment about somebody not recommending SSRIs because of side effects. Absolutely, any medication can have a side effect, but if you are desperate, you've had breast cancer, you've been advised to avoid HRT because of the risk of recurrence, then actually I have seen, although there can be side effects to SSRIs, sometimes the benefit in getting a night's sleep can override some of the side effects. And there are many different types of SSRIs, and if one doesn't suit you or you feel horrible with one, it may be that another one helps you feel better. They can commonly reduce libido and affect your experience of orgasm, but many women I speak to say, look, actually I can put up with that for a short time because my hot sweats were just so debilitating. So again, it's an individual discussion. It's very hard to generalize.
Yeah, no, I think that's just really helpful just to give a bit of an overview.
Yeah.
And we've got somebody that's talking about their hot flushes seem to be linked to when they're feeling embarrassed or times of uncertainty or anxiety. And we know, obviously, you were saying about the function of the brain and just, again, how things like talking therapies and other alternatives like that might be helpful. Someone shared that they use breathing techniques and that have been really useful for them.
Yeah, no, absolutely. That's really helpful to hear, I think, for others as well. No, and so if you can get on top of the anxiety, sometimes it can really help the hot flushes, because what happens when you're anxious is you release hormones that can start to raise your body temperature, and then because your thermoregulatory settings are a bit skew-whiff, then your body sort of overreacts with temperature. So absolutely, that's a great comment. And if you can just tackle that feeling, then that's why that talking therapy can help to manage the hot flushes and sweats.
Absolutely. And someone just mentioned around hot flushes linking to diet, like caffeine, spicy food. I think this is with alcohol that you mentioned before, that and it's an individual thing. So one of the things I know we talk about is tracking what you're eating, drinking and doing against what you're experiencing to see if there are any patterns or any triggers that are unique for each person.
Yeah, that's a great comment. Yeah, totally agree. That I meet some women, even a cup of tea, 2 sips of tea, and that's it. They've gone. It's really variable.
Thank you very much, Claire, and thank you, Sally. And there's some very fascinating comments coming through. I think the final one was back to supplements, and it was a question to you, Claire, around what do you think of Happy Mammoth thing. So I've just looked it up, and it's a supplement which includes, because I know you might not have seen it or you won't have time to have Googled. It's actually extracts, chaste tree berry extract, maca root extract, ginseng, ashwagandha extract. So your comment earlier was around there's not been the same amount of research around supplements. Doesn't mean to say they don't work. It means to say try it, but also talk to your healthcare practitioner, because it can interact with other medications.
Yes, no, absolutely. Particularly St. John's wort actually interacts with many different medications, important medication, like anti-epileptics. Absolutely. And anything that you take for the menopause can have 50% placebo effects. If it's working, it doesn't matter if it's a dummy effect or not, if it's making you feel better. So just make sure it's safe for you. And, you know, there are bits and bobs of evidence that phytoestrogens, wheat plant-based estrogens, can be helpful. If you just need a tiny, tiny, weeny bit of something, then, you know, things like red clover, phytoestrogens, isoflavones can be helpful also.
Thank you very much. I would also add that talking about menopause can actually help with your symptoms because you're not keeping it all in. So I'd encourage everybody to keep talking about menopause and join us for the next Lunch and Learn. But thank you very much, Dr. Clare Spencer, and thank you very much, Sally Leach, and thank you to everybody who joined us today. We look forward to seeing you again. All the best.